Can pelvic floor dysfunction cause chronic anal fissure? The answer is yes, it can. Let's explore this a little bit. Anal fissure is essentially as a result of tightness in the anus, the sphincter. So they persist despite stool softeners and topical creams. The missing piece is pelvic floor coordination. Let me explain this to you. This is so important during bowel movement. The muscles inside of your pelvis have to work with the outside to stabilize the pelvis. Your pelvic floor, where the sphincter is, that area is called perineum. You can have tension in that area, not as a result of working out, but as a result of pulling him into your movement profile. They're there not to provide movement. They're there for stability, and you're using them beyond what they were created to do. When there is tension there, then anything in that vicinity is going to be compromised and is going to be impacted. This is how pelvic floor dysfunction is. Pelvic floor dysfunction is essentially pelvic instability that leads to the involvement of anything and everything that resides in that vicinity. That can involve joints, ligaments, muscles, pelvic organs. So it can be your intestines, your bladder, your prostate, uterus, or ovaries. It can involve blood vessels and nerves. Anything that I just mentioned, everything I mentioned here, can be impacted by your pelvic floor dysfunction and pelvic instability. When your perineum is tight, now in this situation, and you have bowel movements, and when bowel movements are not, the flow is not right, the consistency is not right, because your intestine is impacted, you're not breathing biologically, that allows movement of the intestines to take place. As an example, your internal organs, your abdominal organs, to oscillate between the abdominal diaphragm and pelvic diaphragm in breathing, which is a healthy thing to happen. It happens with your biological breathing. If you don't know what that's like, make sure that you watch the video at the very end where we type in what biological breathing, how to do biological breathing. But there are a lot of things that innately exist. The moment you deviate from that, now you're in the wrong neighborhood of existence. So back to bowel movement. When the muscles inside the pelvis are not being conditioned through biological breathing, they're not being used properly because you have dysfunctional patterns of movement, they have all the reasons on the planet Earth to behave differently. That compensation, that deviation from the way they were created to function becomes problematic. There are muscles in the pelvis that need to let go in order for the bowel for you to have bowel movement. And when those muscles are tight, and that's pelvic floor issue, that's pelvic floor dysfunction. Now you have constipation, you have difficulty having bowel movement, and now you have the areas under pressure. Your perineum is tight, your anus is tight, you're pushing, and so you end up with anal fissure. So sure, you can use a cream. Sure, you can use stool softener, but the reality is, as long as these things that I'm just sharing with you briefly exist, you have the reason for the problem to continue being there. So signs of pelvic floor related issues are painful or incomplete bowel movements. You can have feeling of needing to push. You can have tailbone or perineal tension. And those are very common things that people ignore until the problem gets much, much bigger. So the first step, I should say, to correct the issue is to learn how to breathe biologically. Why? Because when you breathe in, you relax the muscles inside. When you breathe out, it's the muscles inside your pelvis that work together to allow you to breathe out. Of course, there are certain things that have to be in place. For instance, your pelvis needs to be neutral. If you don't know how that's done, then the next step is to learn how that's done. That's what my channel is all about. This is how I talk about functional patterns of movement, dysfunctional patterns of movement, how I use developmental exercises to bring that into the profile of movement of my patients. Developmental exercises are the same exercises you did as a baby, you and I and every walking human being has done. Going from being helpless infant that we could barely hold our heads up to become running toddlers with a nice and stable pelvis and everything else. So it is important to understand how to use developmental exercises to bring functional mobility into the picture. You want to learn biological breathing and breathe that way. And yes, it is 100% possible. It's not easy to do, but it's 100% possible. The next thing you want to consider is to use squatty potty. To practice, if this is an issue that you have going to the bathroom, do biological breathing before and practice that just to relax everything before going to the bathroom. Use squatty potty, which increases your inner abdominal pressure, which makes things easier to go. And finally, you want to pretend you're farting during your bowel movement, before, during, and after. If you pretend you're farting, you're not going to clench your butt, you're not going to tighten your perineum anymore, and that will allow you to relax a little bit more to avoid pushing. Understand that fissures are not okay and they're signs of something deeper. Dysfunctional patterns of movement are very easy. In other words, it doesn't have to take years for them to go away. So there is definitely easy to learn, and they're very innate to you. You've already used them. It's not something new you're learning. It's just something very old that you had forgotten. Make sure you subscribe to my channel. Make sure you follow me on my social media. And if you need help, contact me using one of the methods of contact in the description box. And understand that I listen to you. I read your comments, and any suggestions you may have for any more videos, please share them with me. Thanks for watching.